Hi, my name is Elizabeth Atieno Onyango. I am from Mombasa, Kenya. I work with Coast Sex Workers Alliance, and I give my consent to Global Health Promise to share my pictures and videos in all their social media platforms. Today, in one of our support groups, which gladly Brian Willis from Global Health Promise was there today with us, we got to hear about the challenges that sex workers, especially sex workers who are mothers, face on a daily basis, either as mothers or as sex workers. And we also got to hear about the coping mechanism and how they cope with this stress. It was very interesting to see the different ways that sex workers cope with challenges. And these ranged from alcohol and substance use to some of them just locking themselves into their homes and cry themselves to sleep. Some of them would go, like someone will just decide to leave their children and just go somewhere and maybe drink or smoke weed, which is commonly known as marijuana, and just to cope with the stress. And when asked to share, because they were giving different stories and different experiences that they face on a daily basis. So,
and did some of them talk about suicide?
Yes, some of them shared how sometimes life will get so stressful to the point that some of them think about taking their own lives, or even taking like just hurting themselves or hurting their children. This is as a result of the stress that they face in life daily. And some of the experiences that were shared were from early motherhood. The mothers who had just given birth shared a lot about their experiences. There was someone who shared that she got to a point that she wanted to jump off a hospital window because she was overwhelmed with bills, and also at that time she had given birth but did not have any clothing for her child. So she thought that probably her taking her life will be better for her child because someone better will be able to take care of her child. Some people shared just because of the earnings are too low and they are mothers of not one or two kids but more than 2 children. So sometimes you don't know if the 200 Kenya shillings you have earned, you're going to buy books, are you going to buy food, or are you going to save up for rent and other utilities. So it gets so hard for them to the point that they feel like the only way out is death. And they shared that such support groups help them to share and just feel a little bit lighter, and also come out of the experience feeling loved and feeling like they are really doing their best as mothers and that they are not failing. And so they recommended for the support groups to be held at least twice or thrice a month. And as a person working with and for sex workers, I feel like this one could be a very good intervention because it is not coming out from us programmers or from donors, but it is coming from the typologies who are marginalized the most, and I feel like the intervention has potential. Thank you.